Hello, my name is Dr. Brian Connor, and I'm here to welcome you to NRDNP 862 Practice Inquiry and IRB. I am the course coordinator and will be your faculty member for this fall 2016 course, and I'm delighted to have all of you in the course. Really hope you watch this orientation video. I'll try to keep this very brief, but I just want to give you some insights into what you can expect this semester. And I also like for you to get a chance to see me, since we work mostly online, until you actually either come to campus to present your project proposal later in this semester, or perhaps we can do that virtually. So we'll talk about that. But I really just want to give you a quick overview of what this course is really all about. So first of all, the primary purpose of this course is for you as Doctor of Nursing Practice students to demonstrate your scholarly competency. So what that means is PhD students have to do a dissertation. Thank God, you should all thank God that you don't have to do a dissertation, because you've got so much else to learn to be really fabulous nurse practitioners through your DNP program. But what you do have to do is still demonstrate doctoral level scholarly competence. So this is different than those students who graduate with MSN. They can still sit for their boards and become nurse practitioners, but they are not doctors of nursing practice. And there needs to be some differentiation, and we believe there are a number of ways that we differentiate DNPs from MSNs who become NPs. But one of the main ways is that through your studies here, you have to demonstrate the ability to understand and actually then implement evidence-based practice project quality improvement projects. So in this course, you are developing your project proposal. So hopefully you've heard about this prior to this class. Hopefully you had NRDNP 858, where you wrote a State of the Science paper. For some of you, that may have been a year ago or more, because you are a little bit out of sequence from other students. So what we hope, though, is that you have a good solid idea coming into this course of what kind of a project you want to develop. So what I'm here to do today in this orientation video is just to give you a really quick sort of snapshot of what is it you're going to be doing, and because you're going to have to do this really quickly. We have basically 15 weeks in this course from the time it begins at the end of August until the time that it closes right at the 1st of December. But you don't have 15 full weeks to finish this project proposal, because you have to come to campus and present to faculty, myself and at least 2 other DNP faculty, to gain their approval. Now when I say that, we have also tried to begin developing ways for those of you who are out of the area, not around Charleston or even Columbia, but perhaps even out of state, trying to develop ways that you could do this virtually, and we have resources to do that. So you may be able to do this online, virtually, but nevertheless, you will still be presenting live, and so you will be on camera, and if you're not here, you'll be on camera and you'll be presenting a project proposal. So that's going to happen sometime, we don't have the dates just yet, but sometime in probably early to mid-November, which means, you don't have a lot of time. You probably have 10, 11 weeks, maybe 12 weeks max to get this thing all done and be able to be ready to present for proposals. So that's why it's so critical that you get started very quickly, right off the bat, have an idea of what you're going to do, where you're going to do it, how you're going to do it. Those are some of the keys to the things I'm going to talk to you about here in the next few minutes. So this is really about having an idea how you integrate and implement evidence-based practice into a clinical setting. So here's a couple of things about where you may be able to do your projects. Number one place that many students are able to do their projects is in their site where they're currently working. For some of you, that's hospitals, intensive care units, med-surg units. For some of you, it's maybe outpatient units. Wherever that may be, you can try to develop a project proposal that will fit in the area where you're currently working. What's really important is for you to find out what are the priorities in that place? What do they really think are problems? What's something that you could latch onto and attack as a problem right now as we begin this fall? It's really vital that you figure that out, because part of this is we want you to come up with a project proposal that will be important to you, that's something that you're passionate about, but at the same time it has to be something that the place where you plan to do it thinks is a problem as well. So the alternative to doing it in the place where you're currently working is to be doing it at one of your clinical sites. If you know that you're going to be able to be at that clinical site throughout your residency, then maybe a primary care site, some type of clinic, then you want to check with them about what problems do they have, what kind of a project could you possibly develop and implement in their site. So it's really important for you to be thinking about a potential project, something that you think is a clinical problem. Everything starts with what's the clinical issue or problem that you want to address, and then figuring out how you're going to go about addressing that, what is the best evidence available for best intervention, and how could you implement that intervention in the site that you plan to implement this project in. So there's a lot to think about very quickly. And the next really important factor is, once you've even thought about a problem or you've talked to people in the site where you want to do your project, and they tell you about a problem, and you think about, okay, well, I'm gonna do some literature search. If you haven't done it yet, I'm going to do literature search to find the best evidence available to improve this problem. But you know what? Before you even do that, you have to know that there's a problem in the site. And what I mean by that is we don't want you collecting a bunch of data just yet. I'll get to that point. We'll get to the point of pre-intervention data, post-intervention data, and how you do that. But what we need to know is, if you're going to tackle a problem in a clinical site, you want to know that it's a problem. There must be some data available. There must be some way for you to determine and even be able to show us, yes, this is a problem. So let me give an example. So we've had students in the past that wanted to work on improving treatment of hypertension in patients in a primary care setting. Now, they weren't really focused on different medications, because we really need for you to understand the difference between research and evidence-based practice. In research, researchers experiment. They try new things. They try to develop new knowledge, and often that involves new drugs. We don't want you doing research. You are not PhD students. You are not going to conduct research. We don't want you testing one drug versus another drug. That's research, and you can't do that in this program. You cannot do research as a DNP student. What you can do, and what we want you to do, is to demonstrate the ability to find the best evidence that's already been demonstrated through research studies, to then implement that in the site. So let's take back to the example of blood pressure, and some people feeling that maybe we're not giving our patients enough information on diet, on exercise, on lifestyle changes to try to improve their blood pressure. And so that's great, but you always have to have an outcome. Education in and of itself is not a quality improvement evidence-based practice project. In other words, you can teach anyone anything. You can measure what they know beforehand, you can teach them something new, and then you can measure what they know afterward, and I guarantee you they'll know more than they did before you taught them something, and that's not what we consider an evidence-based practice project. So you have to have some type of patient outcome. So back to the blood pressure example. So we want to improve blood pressure. Great. What you are not doing is looking at individual patients. Again, that's research. When you are looking at individual patients and how they respond individually to some new intervention, then again, you're doing research. And we don't want you doing research. We want you to do an evidence-based practice quality improvement project. Quality improvement means you develop something that becomes a standard way of operating in the practice, a new or different way of doing something that affects all patients within a population. So again, back to the blood pressure example, let's say that you have some evidence-based information that this practice has not been providing for patients, and you want to implement that. That's great. Simple is fine. So something that the American Heart Association, American Stroke Association, somebody says these are important points for people to know about controlling, maintaining their blood pressure and controlling their hypertension. And so you want to implement that. What you want is a patient outcome and an aggregate outcome, meaning for the group of patients, not for a specific or individual patient. So it's very fine. You could come up with data that would demonstrate the mean blood pressure. Average. Mean means average. So the average blood pressure for a group of patients in a practice that are identified, say, as malignant hypertension. Then you find out what that is. That's data that you gather pre-intervention. You implement a new improvement process, and then you measure the same data afterwards, and you come up with that mean. So back to the idea that you have to know there's a problem. If the mean that you are able to get, if the average blood pressure of patients in this site is 128/69, you don't have a problem. You're not going to improve that blood pressure, that average blood pressure. And we're not looking at individual patients. So you may have some patients that have their blood pressure when they come in of 190/110. But if you have a bunch of patients in that same cohort that have blood pressures of 96/60, it's going to come up to average out to a mean that is going to be impossible for you to show improvement on. So that's an example of how we want you to be able to determine that there is a problem. Here's a different example. In a hospital setting, let's say a med-surg floor, that a student wants to do a project to improve falls prevention. It's something that every hospital, every nursing unit does, and some do it better than others, and it still tends to be a problem. So you come up with the evidence-based practice that perhaps this unit is not using, and you want to implement that. But what you have to know is, what's the falls rate before we even tackle this? If it's one fall in 1,000 patient days, that's not a problem. There's no way to improve that, believe me. So you have to know that there's a problem. You have to have some demonstration. Without gathering tons of data, you have to be able to demonstrate to us, the faculty, that there was a problem to begin with, and this is why we need to develop this process improvement, this quality improvement project that's going to be evidence-based. So I hope, I don't want to belabor this too much. This is just an orientation video, but those are the key points that you will need to really think about. Where am I going to do this project? Who's going to be involved? Will I have permission, approval, and is there a problem there? How do I find that out? How do I demonstrate there's a problem so that I can move forward? So those are just some keys to think about. There'll be lots more information throughout this course. I'm looking forward to working with you. We'll stay in constant contact so that my goal is to help you develop successful project proposals, project improvement proposals that you come and get approved, so that when you get into residency and you actually implement these projects and then you complete them, we want you to have potentially we really want you to have a publishable manuscript. Again, this is demonstration of your scholarly competency as a doctoral student in the Doctor of Nursing Practice program. So thanks a lot for listening to this orientation video, and I look forward to seeing you again soon.